Hello and very good morning. Good morning. So today is the fourth day. Now what you do is, say by the end of this session, right? You just let me know the topics on which you really wish to go for the training for further sessions. Say I give you a few example. Let's say ECG, right? So when we'll take this topic ECG, we'll be starting with the basics of heart, and then the conduction, the normal conduction, and then all the way will end it up at the level that is where you can really diagnose, right? That's how the integrated approach is planned. So this ECG is just an example, right? Say for example, I say X-ray chest. So in that will not be starting with like, okay, this is X-ray chest and then we straight away go for the description of it. No, we'll be learning some anatomy of chest, and then we'll understand how the X-rays are produced, because then and then it will actually make the whole thing completely clear. Yes, very good morning for those who are joining now. So this was our topic and this was our discussion before you all came. Yeah, MRI diagnosis. Well, MRI can be done, but see, it would be very difficult for those who are into first MBBS or second MBBS. Yeah, MRI is a fascination. Definitely, if you say, so I can integrate, like say, basics of MRI, right? How, what exactly is T1, what exactly is T2, right? What is short T1, long T1, all those things and their images, right? We can just have a look at it. But see, because it is also called as the cross-sectional anatomy, right? Cross-sectional. Now, in cross-sectional anatomy, before, let's say we are looking at the MRI image of, say, abdomen. Now, if someone is not very clear about the basics, the anatomy part, right? What is retroperitoneal? What are the structures present in the anterior side, etc. So in that case, though we feel that okay, this is aorta, right? It has to be aorta, but then we don't want that you just cram it, right? We don't want that you just cram it, but definitely we'll first take the MRI concepts. That is how the image is formed, because that itself is also so fascinating. Then we can even understand that what are the various different types of CTs. CT scan, all generations. So by the time when you'll be learning the concept, and if you have learned the basics properly and the cross-sectional image that is into anatomy, then it is the combination of all of them, and that can also be taken. But what I'm asking is that let me know for next few sessions. It could be very basic, right? Say for example histology. Now normally this much histology what we learned, it spans in about say 6 to 8 months, right? Every day one topic is taken. Today we'll be taking say 3 4 topics. But what I'm telling is that it's not so that this is end of the world of histology. No, there is so much, right? There is so much, and it can be covered as it progresses. Say for example, when we are discussing pathology, so at that point also, we shall definitely be talking about the normal histology, and then we'll go for that what are the changes, right? So it happens that during our entire discussion, many of the topics they keep on getting repeated, but it is needed, right? It is needed because it would be a sort of revision, right? I came across two questions, right? Two questions they were posted. I have answered them, but just for the benefit of everyone, I'll be taking just 1 minute to answer them. One was regarding that Cartagena syndrome, right? A very good question was as it is that this, which is technically also called as the primary ciliary dyskinesia. Now in that, say question was whether it is in mother or it is in child. Now see, this is a genetic disorder, right? And in genetic disorder, it is autosomal recessive. Autosomal recessive, in simplest words, it is nothing but male, female as well as male. Both should be having that mutated gene, right? Both should be having that defective gene. Then and then it would be coming into the child, and the child would be suffering, right? So that's very important. So whether it is present in mother or it is present in, say, child, well, it depends, right? It depends. Now let's say if the father is normal, so in that case this child would be normal, but he becomes a carrier. So that's how the whole process goes. Now in that, the respiratory distress, right? Respiratory distress, then I say bronchiectasis, chronic infections. These are the most common, right? They are most common. And then when you auscultate, you find that there are about over 50%, more than 50%, they are having situs inversus, right? Situs inversus, and many of them, they are infertile, right? This is like more common in males, right? So that's what we call this thing as a Cartagena syndrome. And say for all these say symptoms, right? It is not so that everything would be present with the same intensity. So there would be some plus, some minus. Yeah, atrial septal defect. See, this is like, say, what we said. You said is atrial septal defect. We can take this entire topic as CHD, that is congenital heart disease. Right? Say such topic can be taken. Now in this case, the advantage would be, say, when we say atrial septal defect, right? So that's the heart, that's on the top, we have got the atria, this is ventricle, and something goes wrong. But what type of atrial septal defect is? Is it high, it is low, right? Many times it is involving those aorta, or it is involving even the, say, other vessels. Is it along with the ventricles? So in all such cases, when we take it in a combined form, right, it will give the complete picture. I really don't want that just I teach you a small portion of something with rest of the idea is absolutely fuzzy. No, we don't want that, right? So we can take it like, your suggestions are good, right? We can take it like this, say congenital heart disease, and that would comprise of atrial septal defect, ventricular septal defect, right? Then tetralogy of Fallot, right? All those things, they can be taken properly. So this will give you good picture. All right, so let's start with, say, this A band and I band. I was expecting that someone asked the question. I thought that I'll answer it in comment section, but somehow I couldn't find that query. So I thought, okay, it will take just 5 minutes, and I added an image also, so this will be in benefit of everyone. We talked about muscle, right? If we literally break down the whole muscle into all its smallest of the component, right? How it goes like that, okay, this is the bone, right? With bone, when the muscle is attached, so we call it tendon, right? When we have got bone to bone connection, right? Bone to bone connection, so then we call it ligament, right? It's called as ligament. And our joints, they are comprised of tendons, ligaments, but whenever it comes to, say, tendon, that means we are dealing with bone to muscle. Now, in abdomen, you will be coming across some other ligaments also. They are also called as the false ligament, right? Can there be something like this? Yeah, there is. False ligament means our entire abdomen, all cavity, all organs, they are covered with the layer what is called as the peritoneum. So these peritoneal, they are folded at some of the places. They are folded, right? So when there are peritoneal folds, so they are called as the ligament, right? But these are called as false ligament because as such, they have got very minimal strength. The ligaments which are from bone to bone, they are really powerful and they give the support. Okay. So here it is, our bone to muscle, muscle belly, right? It is the main belly. And then everything is wrapped in sheath, right? Everything is wrapped in one after the another. So there is a deep fascia. So it is covering everything. Literally like onion, layer by layer, things are opened up. So here is first layer, epimysium, which is outside. You peel it off. Inside you get so many packets, right? So many packets, and every packet is wrapped up in its own sheath. So this packet, this entire packet is nothing but muscle fascicle, and the covering around it is perimysium, right? So here it is, here it is, here it is. Okay, then you go into still more depth. You open this one perimysium. So you will find that there are another small packets are inside, and they are also packed in one sheath. So that is what is called as the endomysium, right? So endo is inside, peri is something which is peripheral, epi is something which is outside, right? And then the entire package is packed into this deep fascia, and this entire system is connected to bone, and that's how it works, right? Now, if you have read the answer about some gentleman when he said, and I really appreciate that when he said that when I'm doing that exercise, I feel my head is becoming heavy with every crunch. Precisely, that's what really happens. True. Because normally when we are doing any of the exercise and if we are taking the gravity into action, we are not deploying all these fibers. Now, right now it will be much more clear that why it happens. Say here, that all these are in, even if we go into that break, we go into the detail of this muscle fiber. So in that muscle fiber there is a myofibril, and that myofibril, which is like a just one fiber, and then that also is having myofilament. Everywhere myo means muscle, right? Myo is muscle. So this is muscle. This particular muscle is having finally the myofilament, and these are the actin and myosin. These are the two filaments which are the proper component of how the muscles they really contract. We'll go into the detail of this piece, but for that exercise part we are deploying these muscle fibers, and that's what we said, that all the muscle fibers, they don't work together, right? They work in batches. But when you keep on putting the load, you keep on increasing the load, the thing what is called as the progressive exercise. So that really improves your strength and endurance, because more and more muscles, they are getting deployed into the system. Okay. So here it is, actin and myosin. These are the microfilaments. See how granular the arrangement is. This is one of the very fine figure, right? Yeah, that's where he wrote thanks to David Richfield, right? So now what it is, let's understand this figure, and this figure will give you amazing clarity. First thing first, and I have kept some space over here, right? So that I'll parallelly draw also, so that we create this entire system. First, we said that there was something like A band, and A band was dark band, correct? When A was, right, and we used to write dark band, so A was dark band. Dark band means who is making it? Whosoever is making it, but he must be thick, yes, because then and then light is not passing and it is appearing as dark, precisely. So let's draw this dark band, right? So this is like our dark band, and we call this band as myosin, right? Myosin is a thick filament. So this is our, what we do is our thick filament. Now these myosins, they are fixed. See, whenever we say that there is some movement is always relative, right? There has to be anchored. Say when you do pull-ups, so it means your hand, one side of the hand is gripped to that bar, and then you lift yourself, right? So there is some anchoring point. Then and then the proper movements, they can be really happening. So over here, these are fixed, right? See, all you need to understand is just two principles and this entire system is completely easy. They are myosin and they are thick and they are fixed and they are dark. And that's why we call that thing as a band. Easy, so far easy, right? Now let's add the second component to it. Regarding this H zone, this zone, everything would come. Don't worry about it, right? So this A band we have understood properly. So we just mark it. A band is now known to us. To that, we are now adding something extra. And that is nothing but the second filament. Second filament is the actin filament, right? It is ACTIN, actin. That will come in between, right? In between them. So let's say we have added this actin filament, right? It is on this side also, so that's also been added. Okay, so these are actin filament. Actin are active, right? So rhythmical. So actins are active. It means they will move, right? And they are light. They are light. So they will be forming I band. Where is I band? Wait, we'll see. Right? Now see, these filaments, when they move, everything moves in a slab. So we have to draw something so that we have to tell that, okay, all of them, they will be joining over here. So I am drawing something over here. So you can say that this is a disc. This is a place where every actin filament has lodged themselves, right? Lodged themselves, connected themselves by some cap, right? So this is like, you can say, rivets, right? These are the rivets. So you have just put the rivets and this is like now actin filaments, they are riveted. So these rivets, we call that, because those rivets, they look like cap, so let's call them Z cap. So they are like Z cap, right? They are like rivets. And this entire plate on which you have fixed all those rivets, we call this thing as Z line. Why it is Z line? Well, for the sake of simplicity, I have drawn it like this. Actually, this Z line is like this. Okay, so over here, over here, over here, it is riveted, and similarly on the opposite side, it is riveted like this. Because see, it is not only one fiber, right? It is not only just one filament we are talking about. This unit, which is called as the sarcomere, right? This one unit, there will be second, there will be third. So that's how this entire system will work. But right now, just for the sake of simplicity, right, just consider this is Z line. Actually, the Z line would be like this. It would be zigzag. So that in between, right, in between, from here, they can go for the other side of this sarcomere, right? So that is the second unit. Okay. Where is I band? Wait. Now, the central portion, central line, there is a fine central line. Exactly, it is in the middle. So let's call it M line. So easy, right? Because it is in the middle, so it is M line. Now see, what happens? This is a relaxed state, and in the contracted state, have you noticed that the distance, that is this distance, correct? That is the complete myosin component. It is same over here. But true, that's what we said, that these myosins, they are fixed, right? When they are fixed, obviously, they will not move. But they do have several components on which the actin will be sliding. So it is actin which will be sliding. So the movement, this is fixed, but it is this actin who will be moving, right? And when the actins are moving, see, the actins, they move from both the sides, right? So this is the Z plate, this is the Z plate or the Z disc. Now see, the entire Z has gone near to each other, right? There is more overlapping of actin and myosin filament. So that's how they move, right? That's how they move. So the point is that under any situation, the size of the A band will never change. How can it change? Because it has been formed by myosin, which is thick, which will not permit the light to pass. So obviously, this thick component, right, this thick component will always remain of the same size, right? And as we said that there is, I'm just removing this, right, because I want to draw something over here. So over here, say there would be continuous, there would be another set of myosin filament, correct? There would be another set, the next sarcomere. This much is also called as the sarcomere. You can say like a brick of muscle. So similarly, this area is where there is presence of only those actin filament, correct? Because the myosin is over here. So this portion, that is what is called as the I band. This is what is called as the I band. So actually I band, half of the I band is on one side, half of the I band is on the other side of the sarcomere, right? So this is where in I band means only actin. However, in A band means it is actin and myosin both, right? But primarily myosin, because even when the muscle is fully relaxed, right, fully relaxed, but still we are considering this distance to this distance. So that is what is called as the myosin. So this was just in brief about what exactly, and this is considered as H zone, Hansen's zone, right? Again, name of the person, right? Hansen's zone. So what it is telling, that how much possibility is there to contract more? What's the possibility? Can it contract more? Yes, it can. So now see, the Hansen zone is just less. That means these actin filaments, right, they moved over each other so much that but now there is no other possibility. They are but on the last verge of stretch limit. Now if you want to stretch that muscle more, you have to deploy more number of muscle fibers, because this activity is occurring individually in every fiber. So when these muscles, now they will be working under that our standard currency, that is ATP. So when ATPs are exhausted, these muscles will say, okay, now our capacity is complete. So then they give rollover to some other fibers. So they carry on. So when you do exercise, when you involve more and more number of fibers, this is how it's effective, right? Okay, this is one slide of neuron, right? But we'll see that after we complete our standard topics. This is the topic which should be well known to you. So this is like connective tissue proper, right? We talked about muscles. Okay. So this connective tissue, again, this is a very high yield topic. Now in this, it maintains the form of body and organ, and the idea is to give support. So first, before going into the details of, say, what are the different types, etc., right? Just a minute. Yeah. Say cells of matrix we see, then we see that what are the names which are very useful when we'll be talking about some descriptions, right? So let's start with this connective tissue. These are the cells of matrix. You will come across fibers and you will come across ground substance. These are the two basic components, fibers and ground substance. This will also give a very important clue for identification, because everything is completely unique in this case, right? You will find it very interesting. Now, few words. Wherever the word blast comes, right? blast comes. Blast is normally for destruction, but over here it is for production. So when we say osteoblast, chondroblast, it means that they are going to form the bone. They are going to form the cartilage. So this is produce. So here, remember that blast is not destruction, blast is production. Right? So that's the first point, blast. Whenever we say site means they will maintain. They will maintain the matrix. They will neither destroy nor produce whatever the quantity is there, but it will keep on maintaining it. And when it comes to clast, osteoclast, that means their planning is to destroy. Right? So blast and clast, they go hand in hand. Old tissues, they are destroyed by clast, and new tissues, they are produced by blast. Right? As very simple as that. And the routine activity is maintained, that is by site. See how easy it becomes as we proceed. So these are some mast cells, right? They are seen in inflammatory reactions where the histamine is secreted. But again, because this is right now, we really don't want to touch the pathology part. But just remember a name, that's okay. They are the mast cell, right? Mast cell. Macrophages, they are seen in immune reaction and they are phagocytic in action. I just want you to know certain terms because this is completely focused for those friends who have just taken the admission, because those who are seniors, so they will find, yes, these are some very basic words. But phagocytosis means, you can say, they are like scavengers. Scavengers. What is scavenger? You must have seen, say, on Discovery Channel or National Geographic, they show the films in Masai Mara, Serengeti, right, in Kenya and Tanzania. Now these are the areas where many of the films, they have shown that the cheetah running at the speed of 110 kilometers per hour, right, chasing a Thompson gazelle, and who is also running at 106, 108, and this cheetah who can run for maximum 400 meters, because after that his heart rate increases by more than 200 and he has to rest. So that 12-15 seconds, that chase, that is amazing, right? That's where you really see that this cheetah, that running at over 110 kilometers, its every leap is over 20 feet. Now the room in which you are sitting, you must be sitting, that's dimension is normally say 10 feet. It means cheetah is jumping from one point and landing on the second point. It's covering your room double the size. And that cheetah whose length himself is over 5.5 to 6 feet, his length, and then there is a tail, and that tail which is balancing his body, and then he is leaping with full stretch, right, and then taking almost a U-turn at the speed of over 100 kilometers, because it is a matter of life and death. So that's, I normally give this example at the beginning of my session, because I say that think about that cheetah. What that cheetah must be thinking every morning, what that cheetah must be thinking, that today I have to run faster than the fastest running Thompson gazelle, otherwise I'll die of hunger, because cheetah's metabolism is very high. They need food, right? So they have to go for this chase. And what that Thompson gazelle, that deer, that he must be thinking, as he wakes up, he has to think that today I have to run faster than the fastest running cheetah, otherwise so I'm surely gonna die. It's like, it really doesn't matter, friends, whether you are cheetah or you are deer, but you have to give your best shot, right, every day, because we have not seen tomorrow, right? So live every day and give your best shot, and work to your excellence, because by the end, when you go to sleep, now ask yourself just one question: was the day worth living? Did I learn something? Something new I learned? Something which is useful for me tomorrow when I wake up? And when cheetah attacks and then finally they finish their food, there comes those vultures. They are called as the scavengers. They literally clean up that entire skeleton. Phagocytosis, these are the processes. They are phagocytic in action, right? These cells, they actually clean up. These are the macrophages. They are like vultures into this scenario. They actually clean up everything whatsoever is damaged, whatsoever is broken. Now, say when we talk about this, and say in cases of nerves, right? Nerves, and say I'm going very fast. Say these are the nerves, and let's say that's the cell body, and this is the axon, and on axon there are myelin sheath, right? These are myelin sheath. Neurons, you said these are the basic components of nerves. So these myelin sheath, what are they? What is the purpose of this myelin sheath, right? I'm trying to integrate histology with a clinical condition along with what we discussed in last 2 minutes. So these are the myelin sheath. The function of myelin sheath is they act as an insulator and they increase the speed of conduction, because nerve is doing what? Say for example, this nerve is attached to muscle, so then brain would say, okay, fire, and then that signal would go and the muscle would contract. This thing, this conduction, neuromuscular electronic conduction, that is where this myelin sheath comes into picture, because it acts as an insulator and it increases the pace, speed at which the conduction is going on, that electrical impulse is going on. This is normal. Now, what would happen? What would happen that in case if this myelin sheath is gone? Why should it go? Well, what if there is some autoimmune disorder? Autoimmune disorder. Autoimmune disorder means body himself is attacking on its own component. Autoimmune disorder. Name of the disease? Multiple sclerosis. So in that case, this myelin sheath is destroyed. It is destroyed. When it is destroyed, that means this poor neuron, its capability is decreased. And because this myelin sheath is destroyed, it is at this point those macrophages, right? Those macrophages will kick in. They'll say, Acha, now this myelin sheath is useless, let's eat them up. So they will eat them up with a process called as the phagocytosis. When this sheath is eaten, right, it's gone. Histologically, you will see all those spaces, because this macrophages, they'll clean up everything, done, and then they'll say, okay, my work is over. My work was to eliminate whatsoever was damaged, cleaned up. And in histology, you will start watching these vacuoles, right? So that's how everything is so properly connected with each other. Right? So this was just an example. So here it is. The matrix, one, what is called as the ground substance, right? And second, there are several fibers. It means that when we prepare something, right? Let's say when we try to create floor of our say residence, so then they put that cement, then they put some other material, then if the design is to be made, so they might put some stones, right? All those things, and that's how everything is prepared. So over here, this is also a sort of that decoration, but with a purpose. There are fibers, there would be fibers like collagen, elastic and reticular. What are they? We are coming to that. But there is a ground substance. You can say that it is like a cement. It's like a cement. First it is laid and then we'll start putting rest of the components. So in collagen fibers, right, so we have got various types of fibers. Now these fibers, one, First, they are the collagen fiber. Collagen fibers, how are they? They are white fibers, right? They are seen in bundles. So they are not alone, they are seen in bundles. And their specialty is they are long and wavy, right? They are long and wavy. So what you will do, right, when you really study this topic, you actually start drawing it like this. When you draw it like this, more and more of your senses would be involved. Let's see over here. So here is the comparison. So we are dealing with these collagen fibers, and if you see these collagen fibers, right, they are like going all the way. These are the collagen fibers. These are the collagen fibers. Now let's see some theory. Everywhere it would be written types of collagen fiber, right? Type 1, type 2, type 3, type 4. Becomes difficult to remember that what is where. So here it is. If you remember just this much, it would be fine. Type 1, write it like that, that type 1, it is present in bone, right? See the bone. But when you say it is present in bone, it itself includes the word 1. So now anyone asks you that where is type 1 collagen fiber present? It is in 1, type 1 in 1, that is bone. So then bone connected with, say, what? Skin, tendon, ligament, capsule, fibrous cartilage. Technically speaking, everything whatsoever is related to joint, correct? But bone gave you the clue. So now bone, tendon, ligament, everything is part and parcel of it, right? Becomes easy. Still best, right? That and skin. So there is bone, skin and tendon. Bone, skin and tendon. So that is type 1. Now you will always remember this. When you say type 2, so type 2 is where it is in cartilage. That is in the, say, we speak it like cartilage, right? Cartilage. So then cartilage is what is present between the joints. So over here, this was one joint, and then there are various types of cartilages, right, which will be giving strength. So that is, we say it cartilage. Hyaline and elastic, we'll talk about it, it will come. But type 2 is cartilage. Type 3 though is so interesting, right? Type 3, wherever you write it like spleen. So this is spleen, right? Then this is bone marrow. So write it like this. This is blood vessels. So that's where these type of fibers are there. So easy, right? So these fibers, type 3 collagen fibers, they are present in spleen, bone marrow and blood vessels. And finally, the type 4. Type 4, speak it like floor. Speak it like floor is 4, right? So in the basement membrane, now you know the basement membrane, right? So in basement membrane, that is where when you saw those epithelial structures, so as they were lying over there, now you have something more to speak on, that these are the flat epithelial cells with flattened nucleus, with less protoplasm, with less cytoplasm, and they are lying on the basement membrane, which is a type 4 collagen fiber, right? So you have added one extra point into your bag. So ligament, tendon, muscle. Now we talk about, say, the second component. If you see just a collagen part, that was this, and collagen was white. This is about elastic, right? So the second type is the elastic, and this is yellowish. They were seen in bundles, right? Collagen, they were seen in bundles. These are not seen in bundles. So they are individual. How to remember that we don't miss this thing? Start writing elastic, right? You will write like this, E. This is separate. 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 This, this. See, they all are separate fibers, right? So that's why they are like individual. When you write collagen, right? So you have to write it like this, right? Like this, right? So these are all bundles. So when you write also, right, make your notes like this. Just by looking, because see in exam, when you have written, right, in your notes like this, just by looking at it, it will give you the idea, yes, this is in bundles. And when you write elastic, you just write this much and then rest is all normal. This will give you that visual impression that these are the individual fibers. Right? This is how we decrease load on our brain, because we always remember, trust me, this image, you will always remember as compared to whatever written in here. No. Any time, means in books, paragraph and paragraphs would be written. When you will read, you will feel, yes, I can remember it. But when it is compounded, becomes difficult. So that's why this is the prime purpose. For these 4 days, this was the only purpose, by giving you as many examples, that you develop this method. One was this, and second was the process, how you will be, say, learning everything in the specific order. These are long fibers, right? Spatial stain needed to demonstrate. So this means when the spatial stain is needed, so this is a bit uncommon, right? You won't be able to see it so frequently because spatial stain is needed. See the fibers, looks itself, single fibers, right? They are all single fibers going alone, right? Not at all in bundle. Just by looks of it, you can say that these are elastic fibers. The third group was reticular fibers. Dark, right? These are dark. Initially that was white, second was yellow, but these are the simply dark, completely different category. Short and irregular. But so I'll keep the word irregular with me. Irregular, right? So they were, though whether they were in bundles or they were in single, but they were straight. These are irregular. Looks, yes. Simple, you look at it and you'll say, yes, they are all irregular, right? All irregular. So no point in getting confused with any of them. They anchor to surrounding connective tissue. So that's anchoring, holding. So that's how they are formed, right? See, irregular. See how irregular, completely irregular. None of them, right? See all this, right? They are the irregular fibers. Distinguished by loosely distributed, dark staining, wavy, short fibers. Yeah, but we understood that. They are short, they are irregular. Gel-like ground substance. Now comes fibroblasts. Fibroblast. Blast means it is not destruction, it is production. Right? So they will produce. Then there were mast cells. Yes, mast cells. There were macrophages, right? And WBC. Is this entire system giving you the idea that they are dealing with immunity, they are dealing with those macrophages, and then they are dealing with those cleansing process of phagocytosis, and WBC, that is our army, they are our soldiers. This entire tissue, this entire package is for immunity, right? It is for self-defense of the body, right? That's very right. They are for the self-defense of our body. See how systematically the plans are there, right? Reticular connective tissue. Locations, yes, lymphoid organs. We guessed it, right? Because we said that it has to be dealing with our immunity system. Lymphoid. See another package. Spleen. Very right. Lymph nodes. Yes. Bone marrow. That is where those WBCs they are working on, right? So a complete package for self-defense. Moving on to the ground substance. See, we said that whenever the matrix, right? Matrix means that material with which the entire thing is connected, means prepared. One was the ground substance, the base substance, and then there were various types of fibers, right? So collagen, elastic and reticular, these are the three types of fibers which we talked about. And the ground substance, now we are talking about that our cement, which is present between cells and fibers. Yes, it has to be present between cells and fibers. It is clearing up, it is filling up all the spaces, so it is acting as filler. It is acting as filler, right? Clear, colorless, viscous fluid, right? Say for example, plasma is ground substance in blood. So good, right? It is ground substance in blood because blood is comprising of all those RBC, WBC, platelets, and all of them, they cannot be put like fill up a bag and just put it into the blood, into the arteries or vein. There is a fluid, there is a plasma, right, in which everyone is floating. Now this reminds me of one very interesting movie. In case if you get a chance, you must see that. Very old movie by Steven Spielberg, the maker of Jurassic Park and many of the movies. The name of the movie, right, is, the name of the movie was Fantastic Voyage. I'm writing it very properly. You must see this. Every medico must see this movie. Fantastic Voyage. Means before you start your medical classes, you must see this movie. Try to find it out. Try to find it out. I'll give you the plot of that movie. Thus, there is a scientist, right? He is somehow, there is some injury, there comes some big hematoma into the deepest part of the brain, which was inoperable, and then it was necessary to save this nuclear scientist. And what was done is, the fantasy starts. They said that let's miniaturize the team of doctors and doctors, surgeons, and the technical team, right? A team was prepared, and all of them, they were miniaturized, right, made of small size. They all were put into one capsule, and right, and then this capsule is injected into the vein, and then rest of the movie is inside the body. Rest of the movie is completely inside the body. So as soon as that capsule opens, right, all of them, they are floating into the blood, and then body responds to it. For body, they are like foreign bodies, so immediately those macrophages, they start coming up for their mind. Yeah, Beautiful Mind, that is also a very good movie. So those macrophages, but this is very scientific. Those macrophages, they start coming and they start attacking on that. So they say, come on, run fast, right? We need to somehow reach to the vena cava. Once we'll be into the vena cava, we'll be able to go into the low pressure area. So they somehow reach over there. Then they say, now wait, see the speed at which the valve is closing and opening, right? So as soon as the valve opens, right, we have to jump into the ventricle, and from there, so that's how the entire it goes. And then they are communicating with the outside world. They'll say, okay, slow down the heart so that we get enough time to cross that valve. Otherwise, these valves are so big, and actually, if you see, they have shown mitral valve, they have shown tricuspid valve, right? So you feel that those valves, they are like closing like this, right? And then they just sneak out. Finally, they reach to the brain, and in there they do the surgery. And then the point at which when they were supposed to come out, they said, here it is completely dark. How should we come out? Finally, they said, see, there is some light. So they said, what it is? He said, this is optic disc. Right? So now catch hold, figure out where is the optic nerve. Right? So they reached to that point, and then they catch hold of that optic nerve, and finally they came out. They said, okay, here is the lacrimal gland. So let's all jump into the lacrimal gland. And then all of them, they come out floating into the tears. They were taken to Petri dish, they were put on the table, and then their size started increasing. This is Fantastic Voyage. I've said you it in very brief, but in the entire movie, because within 15 minutes, so they are into the body. Entire journey, everything is into that, right? Fantastic Voyage, must see. All your concepts would be so clear. When you'll be learning, say, inner ear, you will know that why inner ear is so important, because they said that, okay, outside world, they used to talk like that. Outside world, don't make any noise, because over here, that eardrum, that is moving. So there the doctors were telling that, okay, don't make noise. So then here to there were so many vibrations, right? So that's everything is amplified to such a level that it creates superb impact on your mind, and you feel good and astonished to learn all the facts, right? Okay, so classification of connective tissue now. Right? So this was the ground substance, the base substance in which all the fibers are laid. Now we are talking about the real connective tissues. How? Several classifications they come. One of it is like how they are arranged. Loosely arranged or densely arranged. Loosely arranged cells and fibers, that means they are all soft because they are not compact, right? They are loosely arranged. So areolar tissues, adipose tissue, adipose means fat, right? So they are very loosely arranged. So that's how their consistency is managed. The densely arranged, we do have once again two options. Densely arranged means is there a specific scheme, right? Proper, regular, or it is completely irregular. So that is also one of the things. Moving on to this adipose tissue, which is a loose connective tissue. Just by the looks itself, you see that there are adipocytes, there are fat cells, right? There are fat cells, right? These are all fat cells. These fat cells, there is very less matrix, and how will you figure out this adipocyte nuke? Because over here it is pushed to the edge. So if this is the adipocyte, you'll find that nucleus, they are pushed to the edge, right? It is pushed to the edge. That's the hallmark. This is what you have to see, that their nucleus, right? See, they are pushed to the edge. They are pushed to the edge. And we see nucleus only as a darkly stained substance, right? Yeah, a darkly stained substance. So here, everywhere, right? If you see this thing, nucleus is pushed at one edge, right? This is the entire cell, nucleus. Only one side would be the darker, right? This entire thing, but nucleus is pushed at that edge, right? See, you take up this one, such big, but nucleus is on one side. That's the speciality, right? Location, skin, hypodermis of the skin, the biggest trouble, right? That's where the entire world is fighting for this obesity, right? Surrounding skins, eyeballs, mammary glands. Well, regarding surrounding kidneys, suddenly from where the kidneys have come up, well, it's not only the kidneys, right? This is just an example, even some other organs also. Because say we talk about kidney first. Say in kidney is actually wrapped, it is packed, right? It is packed, and that's what is called as the renal fascia. Anything related to kidney is renal, and that's called as the renal fascia. It is a sort of protective mechanism. Say, in case of abdomen, the moment you cut the anti-abdominal wall, you'll find a big curtain, huge, big curtain. And that curtain, a complete yellowish, means you have removed the muscles, then the thing what is called as the greater omentum, right? That greater omentum is loaded with fat, loaded with adipose tissue, right? Within abdomen, yes, within abdomen, all the blank spaces, right, they are packed with this adipose tissue. Is it bad? Well, up to one limit, it is not bad. You will find that why it happens like that obesity is so dangerous. It is dangerous, just one word of it, which is called as the visceral fat. Visceral fat. Visceral fat is what? That here is the heart. This heart is constantly beating. But what if surrounding it there is so much of fat, and this fat, right, this fat is hampering the beating heart. It is like you are driving a car with handbrake applied to it. Yes, car would run, but it is going to destroy its engine. Same way, visceral fat is dangerous because it is surrounding those organs and it will start affecting their efficiency. So within abdomen, facial planes, yes, that is where these adipose tissues, they are there. Right? See the zoomed effect. Right? Nucleus, they are pushed on one side. So large blank spaces, fat, yes, you saw that. Nucleus pushed to the edge, yes. There were few blood vessels, right? There were few blood vessels in between, right? This is few blood vessels. And sparse ground matrix, that is less because these cells themselves are so big. So actually this is how their formation it goes like, right? And the nucleus, they are just pushed at one end, and in between you will be getting some round structures, they are the blood vessels. So that's how very less ground matrix is there because these cells themselves, they are so big, right? Areolar tissue, otherwise the loose connective tissue, right? They are distinguished by matrix has all three types: collagen, elastic, reticular, gel-like ground substance. So fibroblast, mast cells, macrophage, WBC. Yes, you got it, right? We are dealing with what? So that's how these areolar substances look like. See, so big, right? Distributed throughout, loosely bind structure. They form lamina propria, that is just below epithelia, right? Regarding, don't worry, they form papillary layers of dermis of skin, etc. Right? All these things, they can be discussed, and surrounding blood vessels, etc. But this is the point which I would take home. They are loosely bound structure and distributed throughout. So that's how these areolar tissues, they look like, loosely bound, right? Dense regular connective tissue. Now see, these are the dense regular connective tissue. Tendon, right? The tendon. See, so clean, so dense, right? Densely packed, parallel collagen fibers. Nuclei, they are aligned in parallel. These are the nuclei which are aligned in parallel, right? And very important feature to differentiate from smooth muscles. So this means we are talking about, say, striated muscles. So location, tendons, ligaments. So whether it is bone to bone or it is bone to muscle, and aponeurosis means nothing but it is a flattened sheath. Flattened sheath. So at times, say for example in biceps, right? In biceps, what happens that there is a muscle, right? This is a muscle, and there is a tendon. But then there is, this will not straight away go and lodge at one point. It fans out. It fans out, right? Into the form of aponeurosis, which is called as the bicipital aponeurosis. So advantage is it increases the surface area. So now it is attached to a bigger area to give a stronger pull. So that's aponeurosis, right? This is tendon. So tendon is like a cord-like structure. Aponeurosis is flattened tendon. You can say flattened sheath or flattened tendon, where you have really opened that sheath and now you are applying it on a larger area. So this is what will give the strength and the resilience, right? Because surface is wide. You want to stick something to just one point, or you just apply that gum on a larger area and then you stick it. So obviously if the larger area is given, it will give much better resistance, right? And that's your muscle. Okay. Now dense irregular connective tissue. We are going bit fast because I want to cover as much as possible, want to show you as many images as possible, right? So okay, coming to this dense irregular connective tissue. Dense irregular connective tissue would be formed, would be present only on those areas, those organs itself are a bit irregular, right? Their movements are irregular. So what else can be other than the digestive system, right? So here it is, all the fibers, etc., is their locations, they are irregular, right? Large intestine. So irregular arrangement of fibers, and then they are all densely packed, right? this also gives you the idea that yes, these are the cells which are arranged, right? All those cells. So it is like they are single layer and they are like all those elongated nuclei. So straight, they are columnar. Multiple direction, mainly collagen, major cell type is fibroblast. Again, dense irregular connective tissue. That's what we see over here, right? So reticular layers of dermis of skin, submucosa of digestive tract, right? This is the commonest, and fibrous capsules of organs and joints. Just the capsules, right? Those fibrous capsules, right? When they are connected in that. And this is elastic connective tissue seen in aorta, right? The idea itself is like elastic connective tissue, that is, it should stretch, but when it goes back, it should come back to that original state. So it has got high elasticity, so it should not break. Densely packed, dark staining, right? Wavy appearance, and they are into the aorta. So this is how they are darkly stained, right? They are dark stained and pretty irregular. So within the body of arteries, throughout trachea, bronchial tree, and some ligaments in the neck region. But remember, this is the main. All the arteries, they are elastic. Bronchial tree, right? Our bronchus, elastic. So when we need more air, right, they dilate. And then they have got capability to shrink also, depending upon the requirement. And that's the point of some of the condition, like say asthma, right? In case of asthma, when the air is needed, but for some reason, this bronchial tree, it has constricted. So now you need more air. And this bronchial tree is constricted. So that's where, when the large amount of air is sucked, right, it becomes like that sound. That is what is called as wheeze. Wheeze. So you try to open your mouth and try to take deep breathe with this sound, and that's what is wheeze. That is what you hear in case of asthma. So in asthma, what happens? This bronchial tree is constricted. So when it is constricted, it leads to this wheeze sound. Right? So that's the zoomed view. These are the wavy appearance, dark appearance, and they are present near the lumen. Right? Okay. So this was the connective tissue part. Now what we see is the cartilage. A very high yield topic. The cartilage. These are spatial connective tissue, right? So how do we really see these different type of cartilages? Based on fibers, now we know that there are specific fibers, and we know the ground substance. Ground substance which is clear, which is clean, right? Okay. Ground substance which is clean, based on fibers, and it. So first is hyaline, second is elastic, and third is the fibrous cartilage. These are all cartilage we are talking about. In fibers, right, we know that, see, there were collagen fibers, right, they were elastic fibers, and they were reticular fibers. True? Just to recollect, those collagen fibers, they were like white. We draw collagen like this, so that's collagen. Elastic, they were yellow, right, when they were yellow. And we write elastic like this. You know, you have understood the meaning. They are individual. And reticular, so they are reticular, right? Bus. Ground substance was clean. Now let's combine these structures and come up with something. Hyaline, elastic, and fibrous. Right? These are the types of cartilage. Function of cartilage. Cartilage is present wherever there is stress. Wherever there is stress. Right? Bones, they are providing the support. But when bone starts rubbing to the another bone, both of them, they are going to get destroyed. That's where the cartilage comes into picture. And the first one is hyaline cartilage. It is glossy, shiny. And over here we'll see chondrocytes. Go back to those words. There was blast. Correct? There were clast. There was clast. And there were cyte. Blast was not for destruction, right? It was for production. It was for production. Always speak it like that. Blast is not for destruction, it is for production. Cyte was for maintenance. Okay. So it means we are talking about this chondrocytes. These chondrocytes, they will be maintaining the environment, right? Neither they will increase nor decrease, and they are placed in lacuna. Lacuna is what? The space, right? So they are sitting into a space. This is a space, right? That's lacuna, something which has got space. And collectively we'll call this entire thing as cell nest. See, the imagination is so good, right? Cell nest, as if it is sitting in a nest, right? So this is what is called as the cell nest. Fibers, they are type 2 collagen. Type 2 collagen. 2, you remember 2? We said that it is cartilage. Cartilage. What type of fibers? Type 2. Where is the trouble? So easy. Correct? Now it is making the sense, right? So it is type 2 cartilage. Refractive index of type 2 cartilage is same as that of ground substance. This is a technical point, right? Refractive index is what? Refractive index is when you throw the light, like that light would jump and it will be, say, reflected, reflection, refraction and diffraction. There are three simple things in physics. Reflection, light is thrown to you, it reflects, it comes back, that is reflection. Refraction means when the light goes from one medium to another medium, it bends, right? That's the reason we were watching it like that. You take a tumbler, right, put a coin into that, and then you move your eyes to one point where you actually stop watching this coin. Right? Now you are not watching this coin. You remain at that point. You tell your friend, put the water into it, and as he or she is putting water, suddenly you start watching the coin, right? Because the light which is coming out of that coin, right, as it changes the medium, it bends. So you start watching that coin. This is the best example of refraction of coin. And this angle, that is how much bending is there, that is what is called as the refractive index. That's the reason, that is those hawks, right, those falcons, when they are flying and then there is a fish in the river. See, there is air, there is water. It means that fish is not at its location where it is seen, right? Because this is water and this is air. So in fact, it would look like here, but it is over here, right? But then that hawk, when it is attacking, it takes this judgment, right? Who teaches them this refractive index concept? But he picks up pinpoint, and he will never strike at this point. He will always strike at this point and will pick the fish, right? And all these things, they are occurring at the speed of 90 kilometers per hour, right? That's the speed at which they pick it up, right? This is the speed. So the refractive index, why it is important in our case? Because refractive index of this type 2 collagen and the ground substance is same. So they both will be refracting the light exactly the same way. So when we'll watch the same light from both the substance. So that's why we won't be able to differentiate. That's the reason it is not seen. We won't be able to see it. Ground substance, that is consisting of all those proteoglycans, chondroitin sulfate, just the theory part, don't worry about it, right? Those theory part that can be, say, remembered later on. I'm telling remembered, right? Right now, just understand. So there are interstitial matrix. Interstitial means which is in between, right? In between. Territorial matrix is more, this is cell matrix. Cell nest, right? This is cell nest. And then there would be some matrix around it. So this is all territorial matrix, right? It is this nest territory, another's territory. And in between what you get is that is all interstitial matrix, right? There, because this territorial has got high chondroitin sulfate. So that's why it looks blue. And this interstitial, it won't look blue. Then perichondrium, right? That is the perichondrium, outer surface. This is outer fibrous. There are fibroblast. So they will be making fibers. Blast is not destruction, it is production. It will be making fibers, and these fibers, they are outside. Similarly, chondroblasts. So that means they will be making cartilage. So they are chondroblasts. So this is inner chondrogenic. It means that outer side is fibrous, and then just underneath is this cartilage. Right? So thus it gives a very smooth surface, articular surface. That's where the joints will come into picture. Similarly, this is hyaline cartilage, the second type. Right? See the hyaline cartilage, right? How they really look like. See, right? Okay, just a minute. Back, we just go back. Hyaline cartilage, and I want to show you this part. Yeah, see this. This is the cell nest, right? And see, here is our chondrocyte, right? That's the cell nest, and here is sitting our chondrocyte. Okay, and in between all this is this interstitial matrix. And then do you appreciate that around? Right? Now I'll erase this so that you can appreciate it. I'll just zoom it bit. Can you see that there is a right, a dark area around the nest, that is interstitial matrix, right? Let's see. So that's hyaline cartilage. So chondrocytes in lacunae. Yes, we saw that. This is what is called as the lacunae. This is the space. Okay. Cell nest. So the whole thing is called as cell nest. And we have got interstitial matrix. This in-between matrix is all interstitial matrix. And we have got territorial matrix. Very true. That's territorial matrix. That is also seen. And we have got the fibrous perichondrium and the fibroblast. So here is the external, that's that part, this dark part, right? It is the perichondrium, and we have got the fibroblasts at the surface, right? These are the fibroblasts. So they will be producing the fibers, and they'll keep on making outer shell. Location, as we talked about, all the articular cartilage, costal cartilage, that means for the ribs, epiphyseal cartilage, that means epiphyses, they are the growing ends of the bones, growing ends. So that is where it will be. Embryonic cartilage, obviously, and the respiratory cartilage, right? So these are the locations of hyaline cartilage. Regarding elastic cartilage, these are the points to remember. It is less glossy, less shiny. Chondrocytes, they are placed in lacunae. Yes, they are called cell nest as it is. Type 2 collagen, not visible, same reason. Elastic fibers, single, thin, and they are not in bundles. We know this because we write elastic like this, right? So no need. to say this that they are single thin. We already know it, right? Need spatial strains to demonstrate? Obviously, right? It is not seen that easily. Ground substance, see, proteoglycans, chondroitin sulfate, interstitial matrix, not blue, territorial matrix, blue, high chondroitin, everything is quite similar. So similar, everything is going same. So that's the point, that it is less glossy, less shiny, right? And they are elastic fibers in it. So these are the two important points, right? Here it is. See, these are the areas. Here it is. Here it is. So nicely seen, a big ones, right? Such a good cell nest which is seen with so prominent territorial matrix. That's elastic cartilage, right? And they are eustachian tube. Eustachian tube is what? Which is connecting that middle ear to throat, right? That's the reason that when you go in aircraft, right, as you acquire the height, there is some popping sensation into the eye, right? You need to drink something. You need to say chew something, either chewing gum or anything, so that saliva, it keeps this balance proper, right? Otherwise that ear blocks. So as soon as you land for almost 2 days, right, you feel that your say ears are blocked. Ear lobes, epiglottis, all these are specific cartilages into the head and neck, right? Either into the larynx, pharynx, right? All these are spatial cartilages of extremely small size, very, very small size. Cuneiform cartilage or arytenoid cartilage, they are all of this small size, minimal size, right? But very important muscles, they are connected with it. That's the reason, because of their flexibility, you are able to generate all those expressions and voice. So that's the most important part of it. Regarding the fibrous cartilage, strongest. You just want the strength, glossy, shiny chondrocytes. They are placed in lacunae. Type 1, right? 1. Immediately, it must have come in your mind that type 1 means what? Write O-N-E, bone, right? So ground substance, proteoglycans, chondroitin sulfate, interstitial matrix, everything same, but perichondrium is not present. So here it is. When you'll see that, see, correct, right? That's fibrous cartilage. So here chondrocytes, they are seen in rows and cell nests, right? See, they are seen in rows, right? In one, there will be presence of 2, right? They are seen in rows, right? See, they are seen in rows. Rest is all, and in this is no perichondrium. So when you see at the periphery, right? See, it is abruptly stopping. There is no, say, fibroblasts like this, right? There were no fibroblasts, right? They are not there. Location of fibrocartilage, intervertebral disc. So this is one vertebra, another vertebra in between. That's the intervertebral disc. Pubic symphysis, where the two pubic bones they meet, right? That is pubic symphysis. Articular discs within joints, corniculates, some tendons, those passing through bony pulley, etc. Right? These are all spatial fibrocartilage. Very quickly, right? This is very quickly. We now see the bone. Now in bones, okay, how can we remember all the structure? Can you provide the images so we can recollect? Surely, definitely, no doubt about it. Say once this is complete, right? What I was planning, that all the images I'll put into those my OneDrive, and I'll share it globally. So you should be able to download it, right? So never a problem. So now coming to bones, again it is a special connective tissue, high yield topic, osteoblast, osteocyte and osteoclast. Name itself is telling that it is for production, it is for maintenance and it is for destruction, right? It is for destruction. Collagen fibers type 1, we know this thing, right? This is bone. Calcium phosphate, that would be in the ground substance. See, cartilage, which are over there. Epiphysis, which is like a growing end, right? It is a growing end. And there is a growth plate. So that's where the growth would continue. Metaphysis, which is in the middle. Diaphysis, and the bone marrow, which is absolutely into its center. So epiphysis, it is surrounded by periosteum. Periosteum is a layer of the bone and articular cartilage. Deep to it, there is a compact bone and deeper is a spongy bone. So the compact bone, that's the bone which we see. Inside it, it is the spongy bone, or it is also called as the cancellous bone. Diaphysis, so that was epiphysis. Diaphysis, it is surrounded by peritoneum. Again, deep to it is compact, spongy, and the deepest is bone marrow. Bone marrow, which will lead to, say, production of cells, right? Blood cell hemopoietic activity. So here it is epiphysis, growing end of the bone, right? That's one. It is for traction. So it is pull of muscles, right? This is full and pull. It is for full as well as pull of muscles. And they don't take part in joint formation. See, here it is. I am drawing, let's say this is femur, the thigh bone. That's the head, that's the neck, and then there is a greater tuberosity, there is a lesser tuberosity. Tuberosity means these are the prominence, right? So greater trochanter, lesser trochanter, and say these are the bigger ones, right? That's why they are trochanter. Now these prominence, they are there because muscles are connected and they are pulling it. So when the bone is getting formed, because of the strong pull, you will be getting many of the impressions, you will see. And this is important from the forensics point of view. Because in forensics, whenever a bone is received, right, just by look at it, you see some of the traction points. These are called as the traction point. The traction point where the muscle is attached, and if this muscle is stronger one, so then it will be creating very strong impression on the bone. So from that a judgment is taken whether this is a male bone or the female bone, right? So this is one point. Second, pressure. They do take part in joint formation. So head of humerus or head of femur, so this is the area, this is where it will be taking part into the formation, right? We are talking about all those epiphyses, growing ends. Third one is atavistic. This is independent, but it is fused to neighbor bone. So there are, say this is like a coracoid process, right? So in that, as such, for functional reason, it is a separate bone, but it fuses to the neighboring bone. So it happens. And some are aberrant. Aberrant means not usually present, but well, they come up. Sometimes head of first metacarpal or base of other metatarsal, metacarpals. Many times such small bones, they appear. So lesser trochanter, greater trochanter, so these are the areas. You can see it's so prominent because these are for traction, right? That's for traction. This head, that would be taking part into the joints, right? Similarly, greater tubercle and lesser tubercle, that is for humerus, right? So all these bones. Coming to compact bone. Now we'll be going into the histology of it. Structural unit, it is called as the osteon, right? The same in case of nerve, it was neuron. So over here, in case of bones, it is called as the osteon. And there is a system called Haversian Canal. This Haversian Canal, you have to see it like it is a 3D structure. Though we'll be watching it in 2D, but you have to think it like, I'll show you that how you have to think that it is the way it is 3D. Because in between there will be blood vessels. So central canal, canalicularly connects osteocytes. Haversian canals, they are transverse. Rest is all theory. Let's see this thing to make it easy. Here it is. Say, first thing first. That's, I will just check every point. This is what is called as the osteon of compact bone, right? That is the osteon of compact bone. And in between, right, in the central part, there is a spongy bone. Spongy bone, there are irregular pattern, they are called as trabecula. Then for this compact bone, we have got the Haversian canal, right? These Haversian canal or Haversian system, what it is, they are like round, this type of structure, right? This type of structure, in which there would be lamella. Lamella means layers, and they will be consisting of osteocytes, right? So that they maintain the bone. Osteocyte, they maintain the bone, and in between there will be canals. This whole unit is called as osteon. And like fascia, they were covered, so here it is covered with periosteum. Let's see, and blood vessels will be into this Walkman's canal. See it in more detail, right? So that is osteon, right? And see how they are arranged round and round and round. But see, this circle is not just, it can go into depth, it connects with others. So that's how these Haversian systems, right, they go up and down, and in between there are canals which are supporting this, which are sending these artery, right? So we have got spongy bone, and this is the compact bone, right? So spongy bone, obviously no osteon, no central canal, they are trabecula. Trabecula means they are irregular. They consist of just osteocytes, that means they just maintain, nothing new formation, matrix and canaliculi, right? And space between these, it is what is called as the marrow cavity, right? Red marrow, white marrow, all these various types. Finally, into this compact bone, we say osteocytes, they are placed in lacunae, and what we see in this case is densely packed bone tissue, right? So they are arranged in lamella and osteons, which will be forming all those concentric rings. Those rings, they are called as the concentric rings, circular. See how it is now. Now we are watching the real images. This is, even though it is at a lesser resolution, still you can see that these are all circular concentric rings, correct? Let's zoom this thing. Here it is. See, this is the section of real bone. Here is, that's like concentric rings, correct? See more. Now it is seen so clearly, right? A perfect concentric ring, right? And you are seeing those osteons, right? That's compact bone. So osteon, central Haversian canal you saw, right? Blood vessels, osteoblast, osteocyte, osteoclast. And where is it? Shaft of long bones, right? Flat bones, short, irregular bones, right? Epiphysis where the bone is growing. That's how it is seen. So osteocytes and osteoblasts, right? See, these are the osteo. See now, seen very clearly. Right. So osteoblast, they are for production. Osteocyte, they maintain, and osteoclast, right? They are to be identified on surface with multiple nuclei, right? That's how they are seen. So this is how they are seen. Osteoclasts, right? You will see it like that there are multiple nuclei. This is the identification mark of osteoclast, osteoclast, right, which is for destruction, breaking up of the bone, and that's what is called as Hauschup's lacuna, just a name of it, right? Osteoclast. See, very fine it is seen. This one, right, normally not seen so beautifully. Osteoclast. This is osteoclast. Just remember this figure in mind. Osteoclast, right? How you identify? Multiple nuclei, right? And nuclei, they are always dark. So that's multiple nuclei. That's how you see it, right? That's the zoom. This. And finally, the spongy bone, easy, osteocytes, they are placed in laculi. Type 1 fiber, that's for bone, less densely packed because it is just the center, right, where the location is into epiphysis and inner portions where they lead to what is called as the hemopoietic activity, the formation of RBC, WBC, right? So that was for today. Do let me know for the future what topics you really wish to learn, right? We can make a complete proper series. So for these first 4 days, our intention was just for one, that there has to be a pattern which should be developed into your mind. Second, you should be cramming less and less and understand more and more. Rely more on the images so that you put less strain on your brain. And the fourth and the most important thing, you start developing the concept of what's called as the super reading by formation of brain maps, in which case you use more number of keywords, right, as compared to running long descriptive sentences. So today also you saw that when we said cell nest, so right, so we remembered that it is this lacuna and in that there is a cell, and then over here this was the territorial matrix, and then this is all interstitial matrix. So now if I say this is 1, this is 2, right, this is 3 and this is 4, this much image would be sufficient, right, for remembering, say, the entire topic, right, and you see it and you remember it. Okay, I'll take few questions. This is working of heart, which book to refer, advanced one. Okay, regarding this, so first I would like to ask that I don't know in which year you are, right? The first thing is working of heart. So you mean to say that you want to talk about the physiology of heart, right? Physiology of heart. If physiology is the thing, Guyton is so good, right? Guyton is like a descriptive book. It is like a story book. You keep on reading on and on and on. About one surprise topic on the 4th day? Well, yes, it's good that you remember it. Okay. I'll take 5 minutes for that, right? I just finished this question, and it is good that you reminded it. So for physiology, this is like Guyton is that kind of book which goes like story, right? Constantly it goes on and on and on, and so good. But when you try to make notes out of it, it becomes a bit difficult. So I would say that depending upon which year you are and how much have you really learned, right? I would say Guyton is very good book for clarifying your concepts. Then later on there are several books available and they can be planned out. Still important thing is that, as I said, that try to incorporate the topics which you really wish to learn, right? Obviously for the first MBBS, so I do have something in my mind, and then we are planning for that will go in that specific order. But still, sometimes because we do have a mixed audience, so just let me know what you really wish. In case if there is any favorite topic, or if in case if there is something which you want to learn, right? Okay, regarding what I said, that I'll talk about one surprise part. Now that is, say all of us, we aim for something, right? Those who have taken fresh admissions, they'll say, yes, one day we'll become a doctor, right? Or those who are, say, let's say some athlete, so they do have some wish that becoming doctor is one thing. This is also something which we want to achieve. You might be having some other plans also for your life. Interestingly, I was reading a book and I felt that I'll be talking about that book to all of you on the last day. This book is something which is so phenomenal that you just read first, not more. You just read 20 pages, first 20 pages, and you will be glued to that book. You will feel that what he is telling about is actually very true. The name of that book is Celestine Prophecy. This book is by Dr. James Redfield. Now there are 9 prophecies. 9 prophecies means those 9 universally true sentences, right? And in that first sentence, I'll just talk about the first sentence, that everything in the world is planned. It was into your destiny to become a doctor. Definitely you'll become a doctor, but what quality, that is now in your hand. Now as you take out some time, right, try to read this book. In this book, though it is not very thick book, but at least say maybe 250 plus pages. In this book, you will come across so many interesting things, and they are awesome for the awareness. What awareness is, how this book helped. It happens that way, that when you are confused, and especially, let's say when the patient is in front of you, right, and when it is asked to you that will my son, will my father, will my mother, will they be fine? Will he or she will be fine? Now your statement, that will matter a lot. This entire book is about vibrations. When you start believing those vibrations, you will find that many of such difficult questions the answer of such difficult question, they'll come to you automatically. Say if you'll feel that yes, this patient though is very critical, but then suddenly your heart tells you no, don't worry, right? He'll be fine. And actually you will see that that patient has started recovering. Many times you start getting a very negative vibes, very negative vibrations. And you will come across that later on you'll find that yes, that person is no more. Right? This book is so good, and it is based on, yes, he is a doctor, right? He has written even his own experiences also in that, and how they were helpful. And as I said, that whatever I am telling you, I always tell once I implement on myself. So it's very good on your part, because see, Avantika, it was like a destiny. You were supposed to remind me about this book. Otherwise, definitely this point would have missed. So very nice, right? You remembered it. Thank you so much. All right, friends. Just let me know about the topics which you wish to learn, right? Like a complete series. I gave you a few examples, like say something, because it can be helpful to you, right? And trust me, we'll take it in that way, starting from the basics and then going all the way to the diagnostic skill sets, right? To the diagnostic skill sets. I am not promising you that I'll be covering each and every disease of it. No. As I said, if we touch those rare things, we are rarely right. But that is definite that by the end you will be having a very clear plan in your mind that any topic is to be approached like this, right? Thank you so much, and you have been a very disciplined and fantastic audience. Thank you, and hope to meet you very soon. Thank you, and bye bye. Yeah, do write the topics which you wish, right, into the comment section. So I'll read it from there and I'll plan accordingly. Take care. Thank you.